Welcome back to Cheddar's Opening Bell. The medical community and the world is still reacting to Pfizer announcing its COVID-19 vaccine breakthrough, saying its vaccine candidate is more than 90% effective. And for more on this, we're joined by Dr. Ashish Jha, Dean at Brown University School of Public Health. Doctor, it's great to see you this morning. Before we get into the timeline and specifics of the vaccine, how big of an achievement is it that this vaccine is more than 90% effective in such a small amount of time?
First of all, thank you for having me on. I think this is an amazing achievement. Look, we didn't even know about this virus 11 months ago. Not only do we have this vaccine, we have a whole series of vaccines in clinical trials. This is the first one where we've seen the data. I was really expecting that it might be 50 or 60% effective. I was not expecting 90. So I am happy to be wrong on that. This is really good news.
Okay, so the Secretary of Health and Human Services, Alex Azar, giving an update on the timeline on the Today Show earlier today. Let's take a listen.
So the timeline is Pfizer will be producing and delivering to us approximately 20 million doses of vaccine each month, starting at the end of this month in November. Moderna is also producing. We have anticipated that we will have enough vaccine by the end of December to have vaccinated our most vulnerable citizens in nursing homes and otherwise, and by the end of January, enough for all healthcare workers and first responders, and enough for all Americans by the end of March to early April to have general vaccination programs.
Doctor, does that timeline seem realistic to you? Obviously, we're still waiting on the FDA to give emergency use authorization for this vaccine, approval, of course, which it would need before it is distributed to Americans.
Yeah, so that first we do, as you said, we need to get FDA to actually approve this thing and authorize it. And I do expect that to happen in the next couple of weeks. The timeline that Secretary Azar has laid out is really aggressive. Of course, we all hope he's right. I would suspect it's a little bit more drawn out than that. But it does mean, at least in my mind, that most Americans will be vaccinated by May or June. But I'd love it if it were by March or April. I just think everything has to work perfectly in order for that to happen. And let's keep our fingers crossed, but not count on that necessarily.
And explain to you the way that this vaccine works, doctor, because we've seen some data that show some Americans are still apprehensive to take a vaccine. Talk to us about the efficacy of it and how it would be administered.
Yeah, so I totally understand why people are feeling hesitant. We've developed this vaccine so quickly. But what I think is absolutely critical for people to understand is that the scientific integrity of the vaccine development process has been terrific. Like, there has been no compromising, no cutting corners. We've just gone super duper fast because, of course, we're in the middle of a public health crisis. This is going to be a 2-shot vaccine, 2 doses, 28 days apart. So you're going to have to come in, get a dose, and then come back 4 weeks later to get your second dose. And that's what's going to cause the sort of people to be protected. There's a lot we don't know. How long will the immunity last, et cetera? Will everybody benefit equally? We don't know. We're going to learn more. But right now, things are looking really positive on the vaccine front.
And I think you bring up a really good point there. How long will this last? Because we had been hearing just several weeks ago that it might become like the seasonal flu, that every year you need to get an annual COVID vaccine shot. I mean, does that still seem like a possibility, doctor?
It is a possibility, and because the seasonal flu changes every year, that's why you need a new vaccine. We don't think that's going to happen with the coronavirus, but it may be that the vaccine's immunity just wanes after 12 months. Again, we're learning a lot here, so we'll learn. But my take is, if we have to get an annual COVID shot, that's okay. I can live with that. I get a flu shot every year. I'll get a COVID shot too. If that's what we needed to keep ourselves healthy and the economy going, I think that's probably not a big deal. And we may be able to avoid that, but that is a possibility.
Okay, so Pfizer expecting to have more than 1 billion doses by the time we get to next year. Again, that's good for this population. But we know 4 companies, including Pfizer, did have a vaccine candidate in a late-stage trial. What is the latest on the other candidates, and do you think that they could ultimately, even within the next several weeks or so, or more immediate than that, come forward with an additional vaccine option for Americans?
Yeah, so the 2 things I would say is, first of all, there are a bunch of others that are in late clinical trials. The fact that this one was 90% effective actually makes me more optimistic that the other ones will be pretty effective as well. And I would not be surprised if before the end of this calendar year, before the end of December, we have 2 or 3 more vaccine candidates that have gotten authorization. And that means that there are going to be lots of choices. And we want lots of choices because we've got to vaccinate 6 billion people around the world. 6 to 7 billion people around the world. And so we're going to need every manufacturer we can get, and having multiple choices is a really good thing.
All right, Dr. Ashish Jha, Dean at Brown University School of Public Health, thank you so much for joining us today.